This question is from OMG Seriously WTF. The person asks, my neck and upper back are very, very tense. I can feel hard, painful lumps on my back of my neck, and I was just wondering, are these tense muscles that could be making me feel this way? My first thought was, OMG, I have cancer. These large lumps are cancer, but then I decided to try and be more rational about the situation. I have an anxiety disorder, so I am stressed a lot. I've never gotten a massage before, but my doctor says that my back muscles were very tense, like rock hard. I'm wondering if there's something I can do about this on my own. My posture isn't very good either. How likely do you think this stress, anxiety, and bad posture are to blame for this? What can I do? Thanks in advance for your help. Well, the problem is with the lumps on the back, if you actually feel like round lumps, those things, make sure you get them checked out by a doctor. I'm not saying there's cancers or anything, but I myself have one, and it's about this big around, right on my neck area. But it's built up of like calcium and stuff, so it's kind of like a malignant tumor and stuff. But my doctor isn't concerned about it. He just said if it ever gets bigger, then let them know. But you're not supposed, if anything that's round and moves around like that, don't massage it all, because you can actually inflame it even more then. But people usually have those in the lower back area. That's where they tend to be. But again, I'm not diagnosing it all. Make sure you ask your doctor about it. But more than likely what you're talking about is just really tight muscles. So in the shoulder area, of course. And what would be a good idea too is to have somebody just stand against the wall, not totally against it, but just back up against the wall, and just totally relax and have somebody take your picture. And then what you want to do is take a ruler or something and see what shoulder is higher than the other. So more likely your more painful shoulder is higher because you're contracting it more. So one of the best things you can do is just put your arm behind your back, and then pull your head to the side like this, but then keep trying to reach your hand around. And this hand here, sometimes you can hold on to like a door jamb, so you can give it even more of a better stretch that way. So that usually works really nice. Another option is a tennis ball, of course. You can put it against the wall or put it on the floor, so you can roll back and forth on that. If you don't want to actually get a massage, so that's another option for yourself. In posture, you just got to be aware of what you're doing wrong, because the average person doesn't realize what they're doing wrong with their posture. A really great one with the neck, especially for headaches and stuff, is you're just going to push your chin like this back. Hold it for 5 or 10 seconds, relax, do it a few times. And any time you're having problems, just kind of push it back. But sometimes that works great with headaches, because the problem is our cervical vertebrae, neck vertebrae here, sometimes isn't curved enough. So that's what try to get them some curve to that area then. But also, again, looking at people's posture would be great, so you can learn from them their mistakes too then. But when you're at the computer, let's say you're at the computer kind of thing, don't have your shoulders arched a lot. So you have to mentally think about it, to mentally relax your shoulders when you're in those kind of situations. And when people are stressed out or have anxiety, it's a common thing. But people tend to clinch up, and that's why some people develop like TMJ problems too. So that's one form of why that some people develop TMJ, like temporomandibular joint symptoms or syndrome or disease, some people call it. But it's with TMJ, it's like sometimes you can get lockjaw, or you grind your teeth, or it pops. But with lockjaw, sometimes it lock open, and sometimes you have to massage it to put it back. Or sometimes they'll click too. That's a big one with that. So people are stressed out. Other options for posture is your shoulders. A lot of times your shoulders are like this, like internally rotated, like your palms are like this. So technically when your hands are at the side, they should be like this. So what you're going to do with that is try to bring your shoulders back as much as possible, or have your hands behind your head, and you can even use the door jamb for that to stretch out the pec area. So the pec area can cause areas like that, so especially if you're internally rotated like this a lot more. So that's why, again, bring them back as much as possible. Or you can, with the doorway like this, just kind of lean back and kind of pull it that way and lean forward to stretch out the pec area. So if anybody else has any other comments for her, let her know in the comment section below. And thank you, and hopefully that helped then.